I'm Dr. Gregory Doerr, and we just had an interesting case that showed up at the TheraBand booth with knee pain. So, patient has been walking around for the last 3 days in Las Vegas, and he's been developing some medial knee pain and swelling. And we had him come in and we took a look at him. He had given us a history that he's had some meniscal degeneration, but not necessarily an acute tear. And again, with the 3 days of walking, he's developed some swelling and pain. So what we did is we put him through a series of provocative tests. In particular, deep squat created some pain, but the most provocative test for him was actually single leg stance, where he felt pain and instability. So what we did is we put him through some fascial pull tests to see if we could actually decrease the amount of pain and instability that he felt. And in particular with him, when we corrected for tibial torsion, that was the thing that gave him the most stability and decreased his pain the most. So what we had him do is go into a single leg stance, and what I did was I externally rotated the tibia, internally rotated the femur, and we allowed him to hold that single leg stance to determine what was the decrease in pain. In particular, that was the one that gave him the most relief, although we did check for MCL pulls, we checked for patellar tracking disorders, but I tend to taper only one thing whenever possible. So what we did was we put him on the table, and we did almost like a barber pull, a tape strip that went across the thigh and a tape strip that goes across the tibia. And we used a little strapping tape to create a fascial pull and pulled that tape in the direction that created the most improvement in his symptoms. So with the thigh, we pulled across to medial. With the tibia, we pulled into external rotation, going laterally. And then we had him reproduce his test afterwards, and we were able to determine that with a tibial torsion correction, when he went into a single leg stance, he right away noticed that his pain was less and his stability was better. So what we have him doing right now is he's going to be walking around for the next couple of hours, and then if there's something that we have to tweak, we already know that a little of the lateral tracking made him feel better, and also when I did a little bit of a decompression on the MCL, it felt a little bit better as well. But the tibial torsion correction gave him the most relief. So we'll always start minimalist and try and do that one tape job first, make sure he feels better with it. And if with walking he starts feeling a little bit more pain, we'll add in one of those other tape jobs.